The world is also commemorating International Women's Day. Doctors Without Borders, MSF, is a non-governmental organization and it's throwing the spotlight on cervical cancer. Approximately 311,000 women die of cervical cancer in 2018. More women are dying due to this sort of cancer than pregnancy-related causes in a year. Cervical cancer ranks #1 among cancers killing women in Eastern, Western, Middle and Southern Africa. Yet it is a largely preventable disease. For more, we're joined in studio by Dr Zani Prinsloo, who's a midwife with Doctors Without Borders, Southern Africa. Good afternoon, Zani, and thank you so much for coming through.
Thanks a lot.
Before we get into it, Zani, I want you to elaborate a little bit for us on the profession of midwifery, what it entails, and what role our midwives play in the health sector.
Okay, in MSF, let's start with to explain the word midwife. It means to be with women. So it basically means from the whole time of her reproductive health, which the age group is around 15 to 49 years of age. Midwives support women not only in birth, maybe we are too used to watching stories on the midwife on television, but we do a lot of things. We do pregnancy care, postpartum care. We contribute to safe abortion care. In some countries where female genital mutilation or cutting is very high, we work there as well. Our big aim, and of course, as we say, cervical cancer as well. And because in the end of the day, we don't want our women and babies to die. So a midwife is everything inclusive. She does all these things as part of a job of a midwife.
It really begins to sound like an all-encapsulating role, Zani, and I know you've got projects running in Southern Africa and even further afield internationally. Give us an idea of what you're finding when it comes to female reproductive health and the challenges around care in Southern Africa right now.
In Southern Africa, as we are well aware, we have a high burden of HIV still. And, you know, we have women that is more immunocompromised. We have government sectors and health structures that is not really properly functioning. So, and mostly in our part of the world as well, it's access. Roads are not good, women struggle to get to care in time, or they are simply not educated that there is help available.
Why did the MSF decide to focus on cervical cancer and not other cancers like breast cancer and so on?
Okay, we are a medical humanitarian organization. So #1, we take care of medical needs and we want to alleviate human suffering. So as you mentioned at the beginning of our talk, that 311,000 women yearly die as a result of cervical cancer. And if you think about it, cervical cancer is preventable if we have the right means. Now we have to compare in low middle income countries. Of course the rate is much higher. Why? Women has less access to vaccination and screening. Whereas opposed to if we take countries like Europe or the Northern America, it almost doesn't exist because the vaccines and the screening is readily available.
One of the preventative measures you're mentioning includes the HPV vaccine. I just want to know from your own experiences on the ground with women, especially in our rural areas and low-resourced areas, what is the awareness like and how conscientized are our young women and girls when it comes to this particular vaccine, which is we're still experiencing difficulty around access and affordability?
To be honest, again, it's, you know, even we have a lot of the Southern African countries that is considered to be in the Gavi country, we still don't have enough vaccinations to treat these girls because remember, it's effective. The effectiveness is the best between 9 and 14 years. And what do we get a lot in our projects is women come very late. Because even in my time, I'm 44, I don't remember that HPV vaccine was available. So it's something that is quite new, and also programs. People are creating more awareness now on like massive programs to screen and treat, which is in MSF exactly what we do. We screen and treat, and in other places where it's feasible, we go for primary prevention, which includes the HPV vaccine.
When it comes to generally lower awareness in older, perhaps rural women who are more inclined to consult traditional leaders about lumps in the breast or cervical bleeding. How do you get around those kind of challenges, Zani? Because one would think you'd need a kind of cohesive approach between traditional healers and your mainstream healthcare workers.
Well, in my experience, different places works in different ways. But one of big roles in MSF is we really engage with communities because we can learn from them as they can learn from us. So it's really just about education.
Zani, I want to hear about how willing women are to come forward when it comes to issues around sexual reproductive health. Is there a great deal of stigma still attached around these issues?
Krishni, again, because I work in so many different contexts, it's each context is really very unique in its own. Sexual reproductive health in many places is still like a women's only affair, if you know what I mean. So women will realize in some places to have 15 babies is the norm. In other places to say no for a sexual intercourse with your husband is acceptable. So there's definitely still a lot of stigma attached, but we always try to really educate our communities because that is why we are there. There was a need, a medical need, and that's why we focus on them.
When it comes to cervical cancer, one often reads that it's kind of a silent killer even. Are there any kind of symptoms that women can look out for, Zani?
Yes, they might have some bleeding or discomfort from the cervix, because remember, cervical cancer is mainly caused by the HPV, human papilloma virus, which is sexually transmitted. So sexually transmitted diseases, HPV, it can be detected. So women might have like typical symptoms of bleeding, discomfort during sex, these kind of things.
All right, there is a vaccine out there. Unfortunately, it's not accessible for everybody. What other preventative measures can one take to avoid a cancer of this sort in terms of health, lifestyle, exercise, etc.?
Lifestyle. The thing is, like we said, HPV is the causative virus for cervical cancer. Now, it doesn't mean that even ladies that never had any sexual intercourse can also get, because it's a virus. Transmission can also be by other means. So basically, the only preventative measure is primary prevention is vaccine. That's it. That's the main thing, main one, in education.
All right. Thank you, Zani Prinsloo, midwife with MSF. Thank you for your time on the SABC News Channel.